That's why, again, I've been a chiropractor for 35 years, right? I mean, last 16 just doing diabetes reversal, but I can't imagine this kind of program being developed by a medical doctor or a dentist or a podiatrist. You have to have our kind of training and philosophy of wellness and doing it from the inside out to even come up with something like this. So that's why I think it aligns perfectly. And that's why I think this is a great thing, an added thing for all chiropractors is this plug and play inside their practice to offer that as another solution.
On that note, I want to give a quick shout out for docs listening and or watching. We're going to drop a link down below to connect with Dr. Jeff and his team to learn more about their licensing program and really bring this into your practice in a meaningful way. And in line with that, Jeff, what are some of those practical first steps that chiropractors should be considering right now as they're saying, man, I'd like to start talking about this with my patients? Where does somebody start?
Yeah, well, the easiest thing obviously is, again, becoming a licensee of our program. We do everything. So when that happens, we would create a specific licensee link for them, like an affiliate link. And all they have to do is, hey, Mary, I see you have type 2 diabetes. We're now a licensee of the world's only patented system to reverse type 2. If you want more information, go to this link and watch your free webinar. I mean, it's that simple. That's really all they have to do. And then they go through our process. The patient watches the webinar. They have a consultation with us. They sign up and we do all the work and the doctor earns a fee for that as a licensee. So it's a very simple plug and play type program. So we're trying to make it where the doctors don't have a lot of moving pieces in this, where they got to think about this every day. And I can get into later on, like how easy and how plug and play it is. But that's really what we want them thinking about, is that this is an additional service they can offer with literally like no additional work, which is great.
Yep. In my mind, I want to get into the specifics, but before we do, in my mind, helping, correct me if I'm wrong, being able to help somebody reduce the effects that diabetes has on their body would seem as though that it would help with all of the clinical care that you're delivering in your practice. If they have an underlying chronic condition that's really preventing them from ultimately living their best life at the optimal, at the worst, they're just in abject pain all the time and dysfunction. This seems as though it would be something that actually has the opportunity to enhance the other care that's delivered hands-on in the practice. Am I off base with that, or is that correct?
Oh, 100%. I mean, high blood sugar affects every cell in the body. It's a nasty freaking disease, man. It affects the brain, heart, liver, kidneys, pancreas, spleen, digestion, like everything gets annihilated. It gets all the inflammation and it's affecting everything. So yeah, so when you're trying to be that wellness doctor, obviously doing the chiropractic care is awesome. That's the pinnacle. But if someone's a type 2 diabetic, with all these symptoms, chiropractic is not going to reverse that. So doing it together is a really synergistic thing. And it's just perfectly blended for chiropractors to kind of be the ones that are leading the charge on this, because it's, as you said, it aligns with what their philosophy is already.
Thanks so much for checking out that interview. If you liked it, we have plenty more available. You can check out the next interview right here.